Right. My task today is to share with you how in Singapore we have moved from heart transplantation to ventricular assist device in the treatment of advanced heart failure patients. So this is data taken from the ministry in Singapore, which show that heart disease together with cancer account for the majority of death in Singapore for adults aged between 15 to 59 years old. Heart failure is currently a major public healthcare concern in Singapore, especially with an aging population in Singapore and better survival that we're getting now from acute myocardial infarction. Approximately 5,000 to 6,000 patients is admitted on a yearly basis for acute heart failure to the public hospital, with about 1,000 to the National Heart Centre in Singapore, which is the only designated transplant center in Singapore. The heart transplant program started in Singapore way back in 1990. Up to date, only 60 heart transplants has been performed over the last 25 years, with 3 being redo heart transplant. Predominantly, the recipient were male patients with a mean age of 49 years old. On average, you can see about 3 to 4 transplants on a yearly basis, with our highest number in 2006 with 6 patients. Unfortunately, last year, there was not a single transplant in Singapore. The main etiology for the heart failure in this group of patients is that of ischemic heart disease and dilated cardiomyopathy. And unfortunately, the survival curve for the local patients in Singapore, when compared with national data, they did not fare as well. At 1 year, we have a 78% survival compared with about 86% internationally, and at 10 years, 57.4% compared to 68.6%. The main cause of early death during the first 30 days was the acute graft failure and sepsis. And the main cause for the late death was due to graft CAD. Besides having a small donor pool in Singapore, the other big problem we have is of the potential heart transplant donor, majority of the patients eventually turn out to be unsuitable. For example, it's in 2014 last year, out of 15 possible donors, only 1 eventually turned out to be a suitable donor. This is due to the fact because of aging population in Singapore and because of very strict rules we have with traffic laws. So as a result, from 20 years ago when we first started the program, a typical donor is a young adult who died because of a road traffic accident. Now a typical donor in Singapore is somebody in the middle age with multiple comorbidities, and the usual cause of death is either intracranial bleed or stroke. So obviously, heart transplantation will not meet the demands of the advanced heart failure patient in our nation. And as a result, in National Heart Centre Singapore, we decided in 2009 to bring in the technology of the continuous flow ventricular assist device. We started off with the 2nd generation pump, the HeartMate 2, and later followed up with the hardware, the 3rd generation pump. As you can see, since 2009 when we started the continuous flow program, the number gradually has been creeping up. In fact, the first LVAD that was implanted in Singapore was way back in 2001. That was the first generation of LVAD, the HeartMate XVE, but number did not really pick up because of the bulkiness of the LVAD, the HeartMate XVE. It was unsuitable for most of the Asian patients who had a small body frame. And in 2004, there was a change in legislation to make organ more available in Singapore, but unfortunately, the transplant number did not pick up. In 2009, the first HeartMate 2 was implanted in Asia in Singapore, and in 2012, we implanted the first hardware in Singapore. So to date, starting from May 2009 to December last year, 52 continuous flow LVAD has been implanted in National Heart Centre, with majority of pump being HeartMate 2, and 10 cases of destination therapy. Majority of recipients were male patients with a median age of 49 years old. Mean duration of support was more than 600 days. The mean length of stay post-op was about a month. All the patients was discharged home except for 2 perioperative mortality. Total follow-up period was 94.5 patient years. The main for the heart failure in this group of patients was dilated cardiomyopathy followed by ischemic heart disease. About a quarter of the cases that was implanted LVAD were the crash and burn cases. These are cases that present to us with cardiogenic shock, and the patient needed ECMO support as a bridge to more definitive therapy of LVAD. Average length of stay in the ICU was 7 days, ranging from 3 days to 47 days. And the average hospital stay post-op was about a month. And obviously, from our previous slide, you will know that only a minority of patients was bridged to transplant, 14%. One patient was transferred back to a country of origin. There was one successful case of bridge to recovery. The patient had full recovery of the left ventricular function after 1 year support HeartMate 2, and we were able to explant the HeartMate 2 after a year. To date, there were 7 mortality, including 2 perioperative deaths. Currently, there's 36 ongoing support with the HeartMate 2 hardware, with 23 patients on the transplant waiting list, 4 are waiting to be listed, and 9 on destination therapy. The main complication that we see post-operatively is that of a need for reoperation for bleeding, which occurred up to a third of the patient, GI bleed, and ventricular arrhythmia. The issue of reoperation for bleeding has been addressed after we stopped the practice of using heparin post-operatively as a bridge until the INR become therapeutic. Our current practice now is no heparin routinely, and we just let the INR drift out slowly over the next 2 to 3 days. One of the most feared complications of the LVAD is the pump thrombosis, which occur in 3 patients, which is about 6%, that led to the pump change. And this occurred in 2 patients in the setting of subtherapeutic INR and 1 patient in the setting of sepsis. And 4 patients needed a pump change as a result of percutaneous lead fracture. And what is common in all these 4 patients is there was a massive weight gain after the LVAD. And we see this weight gain in majority of the LVAD patients post-op. Most of the patients report a massive increase in the appetite post-op, and a typical patient that we do usually is about 40 to 50 kg pre-op because of cardiac cachexia. And after op, usually the weight will balloon up to 70 to 80 kg. There was a case of outflow band relief disconnection in the outflow graft, leading to the replacement of outflow graft. Fortunately, very rare complication of pump pocket infection, which occur in only 1 patient. This was a case that a patient had a pump change initially for percutaneous lead fracture, and after the pump change, patient presented 2 weeks later with abdominal pain, and the CT scan showed abscess collection in the subcostal region, and subsequently, patient went on to a second pump change. Due to the hot and humid climate in Singapore, driveline infection is a problem among our patients. Up to about a quarter of patients had some form of driveline infection. But fortunately, most of this infection can be treated with intravenous or oral antibiotics. To date, we don't have to do any surgical intervention for any of our patients with driveline infection. And in terms of the survival curve for our LVAD patient, is comparable to that of the international data. More than 85% survival for our patient 2 years post-LVAD. Besides living longer, the patient also having a better quality of life. Out of 36 ongoing support that we have now, 13 patients are working full-time, 1 patient working part-time, and 3 patients actually resumed school. And this is a more example of patient leading good quality of life. The lady you see in the purple, right in the top right-hand corner, she is a lady who got married after LVAD, the first patient in Asia to get a HeartMate 2. She currently 6 years on support with the original pump. The mean 6-minute walk test pre-op was that of 250 meters, and post-op increased to more than half a kilometer. Patient also fare much better with the Minnesota Living a Heart Failure score, indicating a better quality of life. And most of our patients are taking public transplant in Singapore without any issue. And 43% of patients manage to travel overseas on the device without any issue for holidays or work. So to summarize, the LVAD has revolutionized the treatment of the advanced heart failure in Singapore, with transplant being a very limited option for most patients. Our next challenge for Singapore will be how to manage the long-term complication for our patient, which literally almost 80–90% of patients are destination therapy. Thank you.